Well, the current treatment options for benign prostatic hyperplasia, there's a range of them. Sometimes just some simple lifestyle measures can make the difference because you're treating the symptoms. So sometimes you tell people to, withhold fluids a little bit after dinner, cut down on caffeine, which is a fairly well-known sort of strong, smooth muscle stimulant. But sometimes a few of these just minor lifestyle changes can actually make quite a considerable difference so that they don't need anything else other than that. But assuming that you've done some of those lifestyle things and people still have some symptoms, and there are at the moment, two well-known classes of medication that can help relieve symptoms. One of the more common drug treatments is the use of a drug called alpha blockers. There are a number of brand names of these, but they relax some of the muscles of the neck of the bladder and within the prostate. And as a result of that, typically patients will find that it's easier to pass urine, there's a better stream and better bladder emptying. There's also another class of drugs called 5-alpha reductase inhibitors. There's 2 or 3 different types of those. And what they do is that they physically shrink the prostate by stopping the conversion of testosterone, which is the male hormone, which is what causes the prostate to grow in the first place, to dihydrotestosterone, which is the active metabolite of testosterone. So by cutting down on that conversion from testosterone to dihydrotestosterone, the prostate actually shrinks. And that also leads to some long-term benefits as far as symptoms are concerned. So if people fail medical therapy, they'll almost certainly be offered surgical therapy in the form of a transurethral resection of a prostate. That's a procedure where your urologist under an anaesthetic will telescopically pass an instrument called a cystoscope through the eye of the penis so that we can actually physically see the prostate. And then using a movable loop, you can cut away strips of the prostate from the inside to create a much bigger channel. And some people call this a rebore. A lot of lay people do that because that is really what we're doing, is that we actually are really reboring a new hole within the prostate to make the opening larger and obviously to make the passage of the urine a lot easier. There's no real advantage for men to be diagnosed early if you're certain that they have benign disease. So that obviously if they've had severe symptoms for a long time, you don't want to be persevering with that for too long because of some of those long-term complications that we mentioned earlier. But generally it progresses very slowly over a long period of time. The main reason that I'd suggest that it's worth getting some attention from either a local GP or, if the GP feels necessary, from a urologist, is really to rule out the possibility of prostate cancer. Prostate cancer very rarely is the cause of symptoms, and in fact, more often than not these days, prostate cancer presents in an asymptomatic man with having no urinary symptoms at all. But nonetheless, occasionally a prostate cancer can cause urinary symptoms, so it's always worth getting assessed by your doctor to make sure that there isn't a problem there. The other main cause is hormonal, that testosterone, through its metabolite dihydrotestosterone, causes prostatic growth. So we know that is a potential cause of why people get benign prostatic hyperplasia. It's not really genetic. There may be an environmental factor which we're not absolutely certain of, because BPH is relatively uncommon in Asian populations of men, as is prostate cancer, whilst it's actually quite common in Western countries. So the question is there something bad in a Western diet that's contributing to the development of both BPH and prostate cancer? And in addition to that, is there something good, conversely, in the Asian diet? And there's quite a lot of research that's going into that sort of epidemiology at the moment, but obviously it's still uncertain at this stage. Well, certainly there's a number of areas of research in benign prostatic hyperplasia. Obviously, people intuitively like to avoid surgery if they possibly can. And as a result of that, that's really what's led to the development of the alpha blockers and the 5-alpha reductase inhibitors. And obviously, ongoing drug trials with new agents are certainly being looked at the moment. But in addition, combining them, I mean, in the past, people, for example, used either just an alpha blocker or the 5-alpha reductase inhibitor. And it's only been recently that people have said, well, why don't you take them both together, because they work in different ways. And in fact, there is some evidence to suggest that the two together in some men works better than either one alone. So they're the sort of trials that are going on from a medical point of view. Surgically, there's a lot of interest about new technologies to try and reduce any side effects or complications from surgery. So in particular, a lot of interest in laser technology and whether lasers are a more effective way of being able to remove the prostate than the standard electrocautery that we currently use. So there's quite a lot of active research, both from the medical and surgical aspects of this disease.